Thank you, Dr. Jarrett. Thank you, Rebecca, Brian Cole, and the Fielding School of Public Health for having me here to talk to you for hopefully much under an hour on assessing urban environmental pollution exposure among the general population. Now, this title is slightly different, I think, to the poster you've seen, but it's in the same theme. So Mike's already run through my background, but let's talk about, I guess, some objectives or questions maybe we can answer hopefully by the end of this 40 minutes or so of presentation. So very quickly, who I am and what I'm talking about, just introduce the theme and myself to know where I'm coming from, in a bit more detail to what Dr. Jarrett has just done, but then looking at different methods or ways that we can assess exposure, but also the effects on the body from that exposure, and then have a little peek as to what might be next in these methods for assessment. And then hopefully there's some time at the end for you guys to open up the floor and discuss anything mentioned here or anything that has come to your mind from this talk that might be related. Okay, so who I am. So it's already been mentioned where I did my undergraduate and my postgraduate work. But just to emphasize, I guess, Dr. Jarrett's call that if you do get a chance to go to COEH, which is now IS Global, the Institute for Global Health, this is the building in which they're based here in Barcelona by the sea. So definitely recommend to try to get there if possible. It was definitely a privilege to be there myself for a few years. And some of the work presented today were from my time there. There are some slides at the end, which I probably won't present unless we have time, but going into the theme of Cook-Serve emissions and health, which is what I'm doing currently now in Fort Collins, as Dr. Jarrett had introduced. Yeah. So I'll start, you can't see yet, but what I'm talking about. So urban environmental exposures, what do we mean by that? So what I'm going to focus on today is air and noise pollution, typically in an urban environment. This is emissions from traffic, motorized traffic, but also look at aspects of physical activity as a consequence of urban design, and also greenness, how that can factor into how the health effects play out with certain exposures. Sometimes they help, sometimes they hinder, and make matters worse.
Oh, speaking of making matters worse, that's the kind of help you don't need.
That's my wallpaper of the computer, so I don't know if that helps to work out.
Let's see here.
So in terms of assessing those exposures, two kind of major methods that at least I have experience in is with sensors, so physical things that are reacting with the environment to give you an idea of the concentration or level of that exposure. For example, with air pollution, it could be a particular gas. It could be noise from a sound level meter, but also...
Okay, I guess it's a fluorescent.
That's fine, we'll get through it, yeah.
Greenness.
Greenness, exactly. So what we're seeing is that this is good for you. This exposure to green is restorative. Okay, so I started to mention the sensors that can be used, and these are moving towards a compact size that can be worn on the person, but also to look at a more population applicable exposure measure is looking at maps and models. So it's kind of hard to tell with this map here, but essentially this was produced from a study called ESCAPE in Europe, in which they kind of mapped or made layers of air quality throughout a city to be able to say where someone is, where they live, what is the estimation of exposure at that point, to know on a larger scale with a larger number of people or population what could be happening because of that exposure. Okay, so when it comes to pollution, and today I'll really just focus on particulate matter as a form of pollution, but really the consequences that we see come down to size. So it is very important to consider size of the particles in the environment and the consequences because of that size. So here is, this is meant to be a hair follicle of a human, a fine grain of beach sand there, just to show relatively how small these particles can be. So in my slide, this is blue. This is what we call PM10, and 10 is referring to the diameter of that particle, and this is in the micrometer range. So this is PM10 and lower, or less than 10 micrometers in diameter. These are the particles that are able to get down into the respiratory system. So we have natural defenses in the body such as hair in the nose, undulations in the nasal cavity, mucus that kind of trap these larger particles. But as we get down to the smaller particles, they're able to penetrate deeper down into the lungs. And this is kind of shown here, broken up by sizes, that once we start to get down to less than 1 micrometer, so into the kind of nanometer range, the particles are able to really get to the end of the airway, so the terminus being the alveoli. And at this point is where the really serious consequences can occur, because the particles are able to, for one, if they're not able to pass into the circulatory system through the membrane in which we naturally exchange gas, so taking oxygen from the environment, breathe that in, that's carried throughout the body via the blood, and metabolic waste such as carbon dioxide done in the reverse, but these particles can pass through that interface and be carried to the body and cause serious problems such as from systemic inflammation, atherosclerosis, or hardening of the arteries, heart attack and stroke, because of these particles lodging, causing chronic irritation because of that systemic inflammation and leading to disease states. Okay, so the font of this slide is quite small, but it's just to kind of emphasize that there are a lot of conditions they're seeing now in the population because of exposure to air pollution and these smaller particles, even down to the extent of affecting the nervous system, being able to transgress neurons, and even to have effects on the reproductive system. I think they've seen in animal models that fertility is reduced as a consequence of exposure to these kinds of small, tiny particles. Okay, so we're starting to move towards maybe some reasoning, or hopefully you have an idea of why we're talking about this, why it might be important. And it's because it's essentially a very complex pathway in the urban environment. So this was from a paper done by a PhD student, Nelly Mueller, in Barcelona, as part of the PASTA project, which some of the results we'll look at soon. But essentially showing that there is this series of consequences because of urban and transport policies moving towards something as serious as mortality. And today I tried to highlight that we have the good environment, and transport is a stepping stone towards disease states because of the environmental exposures, but particularly just focusing today on physical activity, air pollution and noise as a consequence of these built environment and transport changes due to policy. Okay, so in the theme of transport, this was from a review paper 5 or so years ago during my PhD, where we looked at it was a review of the concentrations of ultrafine particles experienced within cabins or the inside environment of different transport modes. Just to show that as a consequence of the transport mode we take, our exposures can vary because of that. There's other factors, such as if you're in a cabin for motorized traffic, that ventilation settings, windows can have an effect on what is taken inside. And cycling, while it's typically seen to be the lowest in exposure, really depends on which routes you take and how vigorously you're cycling and therefore ventilating and taking in those pollutants. Should have said at the beginning that if you need clarification on anything I'm saying, then we can try to do that quickly. Otherwise, I guess we'll hold the questions to the end. But let me know if there's something I've said that just doesn't make sense. So then focusing in on consequences of fuel use. So this is just looking at buses and comparing the different fuel types of buses and showing that really that can have an influence on the concentrations experienced inside a transport mode. So what's odd about this is that the electric bus, so buses driven by electric means, actually had quite a large, a higher trip weight mean of ultrafine particle concentration compared to natural gas. The paper didn't go into detail as to why that is, but it's something to think about why that would be the case, and maybe at the end of the talk we can try to answer that. Okay, so let's continue on showing why this is such a problem, air pollution in our environment. The World Health Organization just released last year the Global Burden of the Disease study, and this was showing the essentially the fine particle concentration across the world, modeled with the data that they had available, really showing the problem areas throughout the world These darker areas here being the high concentrations of the fine particulate matter, and really seeing this problem occurring in countries that are at the moment developing in terms of maybe don't have the best regulatory practices in place, but developing in terms of more people moving into the middle class and having the means to get the means to get motorized transport means, and therefore increasing traffic and the emissions from that. So then when you look at the estimated excess deaths because of air quality, you see a similar pattern that these are the countries with a higher level of particulate matter, the same countries in which we have this excess mortality as a result, particularly in India and China. It was predicted that more than half of the deaths occurred in those two countries, and these being the two fastest growing economies currently in the world. Focusing in on the US, we have, particularly in California, it's seen as a problem that we have this excess mortality due to fine particulate matter. So this is showing the particulate matter in the States, and again, it's kind of hard to tell with the guide, but the darker areas are the areas in which the air quality levels are higher than recommended to avoid excess mortality because of that exposure. And this is showing the estimated number of deaths because of that breach of the air quality guidelines. California seeming to be quite in excess, but this is partly to do with the population size of California being much larger than other states, but also because of, you might be aware, the issue with traffic here. Okay, so how do we assess exposure? So there's a few different ways. I mentioned at the beginning that we'll be looking at sensors, and this was done, a study during my PhD in which we rode on a bike with this monitor here of ultrafine particles, and while we were collecting those, we also logged with GPS the coordinates, so we could put that together in a geodatabase in GIS and see what the air quality was where the cyclist was, and we essentially compared low and high traffic routes or routes riding with traffic or away from, and compared the concentration of ultrafine particles. And while this map might not say much, when looking at the accumulated dose of this, we saw that when riding with traffic rather than avoiding it, that the inhaled count of particles was twice as high, and this was significantly so for this route riding with traffic. So while the ideal is the air quality in general of the city improves, there are personal choices you can make to reduce your own exposure to, for example, traffic-related air pollution. A similar study on a larger scale was done for Collins, where I am now, and this is to show or kind of re-emphasize that idea that the transport mode you take and that route with that transport mode can really affect the exposure level of certain pollutants. And this was showing that the alternative bicycle route or bicycle route taken away from traffic, while the mean of that trip for particle number concentration, which is another measure or way of saying ultrafine particles, because the concentration typically is dominated by ultrafine particles or particles in that tiny range, that while the kind of mean exposure was lower when you looked at the accumulated exposure because of the trip taking longer to do the same distance on a bike rather than a car, that the accumulated dose was equivalent to that in a car or riding on a more direct route but with traffic. So other ways to assess, I mentioned before, maps and models can be used, and this is just to visualize, and maybe it's hard to do it with this screen filter, but this is Barcelona City, and essentially this was, I think I mentioned before, from the ESCAPE project, that they had modeled the air quality levels throughout the city, and they did this based on using regression techniques and comparing air quality levels from a 2-week campaign to the features of that, of the urban design, to see if a certain area has certain features of urban design, then it's predicted that the air quality will be at this level. And then that can be kind of fixed to a permanent regulatory monitor, such as this very bulky but very precise instrumentation that the government typically uses to regulate air quality. But that layer, if you imagine that flipped, can be moved up and down depending on the actual air quality measured by this. Once the smaller measuring campaigns being removed, to be able to give you an estimation of air quality at whatever point or resolution temporally that you have for the government regulated information. And then you can compare that to where people are spending time to get an estimation of their exposure level. And that just re-emphasizes that. So I will show a few slides later on some of the health outcomes of a study that's just being submitted for publication, and this is comparing where people lived, where people worked, the time spent at these places, and then seeing how that resulted in terms of subclinical health outcomes. This is just to highlight that there are limitations with using a model, because while it can be very spatially applicable to a large population, it's not going to cover everyone. It's really limited by where the map exists, of course. So you can get still missing values if people are living outside of that region covered. For example, out here, this is just the extent of Barcelona where the map does cover. So this can lead to missing data and therefore weaker statistical power when you're performing analyses on exposure and effects. Okay, so this is to show the space-time weightings that typically attribute exposure to a health outcome, and it could be from hospital admissions that you look at where people live and just look at the mean of the annual level and relate that to the outcome, morbidity, mortality. However, if you're able to have information on where they've been in the days prior to, you can adjust or weight that exposure level to be more applicable or more kind of refined to see more accurately or in a more refined way what the actual exposure was of this person prior to that incident occurring, such as being admitted to hospital. And if you go a step further and consider where they're spending maybe 8 hours of their workday then looking at the level in that environment, and then similarly weighting to, again, hopefully get a more accurate idea as to just applying this very broad annual level of exposure to the health outcome. You can go a step further and look at accelerometry. So if you know what an accelerometer is, you might have a Fitbit. It's something that tracks your activity based on movement upon an axis to predict how much physical activity you're getting in a day. You can overlay that, that level to the estimated air pollution concentration that you have. For example, here's nitrogen dioxide in Barcelona, and see, knowing ventilation or predicted ventilation from activity level, having an estimation of what that actual inhaled count was for that day or over whatever period of time you want to follow yourself or that person. So assessing effects, I'll really just look at three ways to do that today. One way is heart rate variability, which is looking at the period of time between each heartbeat. So naturally there's variation in that. It can depend on the input from the different arms of the autonomic division of the nervous system, in that you have input from sympathetic and parasympathetic arms, which are kind of dealing with fight or flight. So if you have a stress response from the environment, then there's going to be a more consistent period of time between each heartbeat. So you can follow someone recording that and get an idea of how they're reacting to their environment through that pathway. Blood pressure is probably more commonly known measure, and lung function as well. So to look at how we've essentially responded to the environment, and this is kind of in the pathway leading to the disorders that we kind of listed before in this image that we saw, is kind of signs and symptoms that could lead with chronic exposure to that disease state. So with heart rate variability, this is a very hard figure to see. It's in the publication, you can read, which is there cited on the left, but essentially we had an experimental study that had people in an area of high and low traffic. We had them either rest or intermittently exercise for 15 minutes on and off. This was to kind of emulate commuting actively or sitting in motorized transport. And essentially we saw that with SDNN, which stands for standard deviation of the normal to normal interval, which is essentially an overall indicator of heart rate variability, did actually, in the higher environment, reduce at rest. However, when people were active, they had this 15-minute on and off exercise, that we lost that effect. So it seemed the exercise in some way was having an impact on how that exposure, in this case ultrafine particles, had on the modulation or regulation of the heartbeat. And this is to kind of show that it's important to, as much as possible, collect real-time concentrations, because this is showing essentially an exposure response curve. So on the y-axis is this overall indicator of heart rate variability. On the x-axis, this is the concentration of fine particulate matter, just to show that it's not simply linear. So we can't just assume that with a higher concentration of a pollutant that we're going to have a increasingly or in parallel a higher response of that health outcome. Then, coming from the same data set, that same experimental study, we had a PhD student look at blood pressure, and they saw a similar thing, that exercising, the main message is that exercising in an environment of higher pollution led to a reduction in the benefit of lowering blood pressure because of exercise, if that makes sense. So we perform exercise to essentially improve cardiovascular fitness, and one way to do that is via lowering blood pressure, which happens. So again, kind of hard to tell, but you have here, just in a low traffic environment, you have either at rest, which is this, and then you have exercising for that 15 minutes intermittently, and this is the exposure period, about 2 hours. These people were followed up for different time periods after, but you see this drop here in blood pressure because of the physical activity performed. But when you look at that happening in the higher pollution environment, you have a reduction in that smaller size difference between at rest and exercising. So we lose that part of that benefit of exercising because it's being done in a high traffic environment. If you can compare the size difference of the gaps there, essentially here after the exposure. Okay, and again, similar story with lung function. We saw that the increase in lung function that you might expect after exercise essentially was attenuated. We had less of an improvement in lung function when it was done in an environment of high air pollution. So comparing, this is at rest and this is physically active, that 2 time points before and after the exposure period, which they are also for rest or physically active, that in the high traffic site, which is the darker bar, that we did not get this gain. While it wasn't significant, there was still an increase in lung function performing physical activity, but only in the low traffic site. Okay, so if you remember before this map, and I talked about space-time weightings, knowing where people are and therefore estimating more accurately what they're exposed to rather than just using the measure at their home for a year. We saw from that, looking at the same measures, this is heart rate variability, that we did see a reduction significantly in heart rate variability, which again is not a good thing. We want variability in this time period between each heartbeat. But this was only really seen when we got down to the daily scale of the air pollution concentration, in this case, coarse particulate matter, which is the size fraction of PM10 and PM2.5. Again, this is the particle size that is getting down into the mid-airways, not quite the end, but we see here that there was a significant reduction, but then factoring in another exposure such as noise, and this was noise at the occupational address as a daily average, that then we lost this association. So just to highlight that it is important as much as possible to collect an array of exposures in the urban environment, because there is a complex interplay between those, and we really need to consider everything. Obviously limited by the funding we have for the census to do that, but similar story with blood pressure. We saw that there was an increase in blood pressure due to the ozone level at the residence, and this was only really seen on this is at the annual level, but that when considering, again, noise, that we lost this association. So there could be more into it than just confounding, but it is just kind of highlighting that we need to consider these different exposures together. Okay, and then spirometry, similar story. We did see a reduction at the annual level of ozone at the participant's resident, but then considering other factors, in this case, this was the greenness around a residence. There seemed to be some kind of protective effect of greenness there, or something going on at least with, if you lived in an area that was more green, that you had less of an effect of that ozone on your lung function. And I didn't highlight before, but these are all healthy individuals, so it is a bit more impactful to know that these aren't people that are susceptible to these changes in health outcomes, but everyday people, healthy otherwise, are actually being affected, at least subclinically, by their environment and the exposure within it. Okay, so we can look kind of quickly on what is next in exposure assessment. So hopefully you now have a bit of an idea as to what we can do and what has been done. A lot of work has been done. I've shown only a very small amount that I'm familiar with, but I would encourage you to read into it. So what we might hope to see next is that we have improving assessments, so we are able to get more accurate measurements, but also improving conditions. So the data we have collected so far showing that yes, there is health effects because of that exposure, and we know in a way at certain levels what that level of response in health effect is. But we would hope to move to more accurate measurements, and this could be by improved function of ambulatory sensors, so sensors that you can carry around with you on your person to get kind of personal or more accurate measurements as you move throughout an environment. Online mapping and survey follow-up, so online mapping being more of a public health service that you can see throughout your day what the air quality might be like. Say, for example, if you are cycle commuting, to know to avoid certain routes, you might go one way or another depending on traffic congestion on that particular day, and therefore the consequential increase in air pollution because of that. But also from having surveys that are able to follow people up to relate their behavior in terms of, say, transport and the health outcomes that might come from that. So thinking about a longitudinal study in which maybe very typically it could be a cross-sectional survey to ask where people are living, how they're experiencing that pollution, but to actually, because of online means, being able to follow them up a lot more easily to get more information from a larger population because of the smaller amount of work needed to collect more information. Also, more sensitive non-invasive health checks. As technology is improving, we can get an idea more in the body of what's happening without actually causing harm to participants, and therefore getting more participants involved in studies because it's less of a risk for them. But we also might want to look at cleaner environments. So we're getting technologies now that are leading to reduced emissions, and this could be because of less motor vehicles or designing the environment in a city to encourage people more to walk or take public transport. And then with that, you get the consequential reductions in air pollution emissions and therefore improvements in air quality. It seems to be more of a shift towards hybrid or electric vehicles, which is great in terms of air quality, but we have to consider other factors such as physical collisions, but also noise and resuspension of dust that happens still with those vehicles despite them being clean in terms of the combustion emissions from their engine. And I mentioned at the beginning that I have a few slides on cook stove technologies and the impacts of those technologies on health, but I will only go into them if we have the time and interest, so I'll ask you about that. Okay, so looking at this first point, more accurate measurements. So this was an initiative led by Dr. Jarrett and published this year, looking at an ambulatory sensor that people could carry around. And this was dubbed the camper, because this was done in collaboration with the University of Cambridge, so camper standing for Cambridge Personal Sensor, I believe. But essentially this is that accumulation of what I showed at the beginning from my PhD project, that we had an air quality monitor separately coupled with a GPS device to be able to track what the air quality is, where a person is in time and space. So this was I think one of the first initiatives to try to do that, to get it compact and accurate enough for people to get personal assessments of air pollution exposure. And while they saw that when comparing to what you could call regulatory grade devices, the data coming from that while the correlation wasn't as high as you might hope, to use it as a kind of complete reference, it was definitely capable in giving an indication of the patterns. So when someone was in a highly polluted environment, this was reflective in the camper. as it was with the other more expensive, less portable devices. So it's giving you an idea of patterns. So if people are in higher or low environments in terms of air pollution. Now, this was done around the same time as the CitySense project was trying to do the same thing. And in fact, there's quite a few groups that are working on these ambulatory sensors, particularly for air quality, because obviously, hopefully, you might understand now there is quite a need for it. But this was the CitySense project funded by the European Commission, and this is just a 90-second video which might explain the way we're moving in terms of exposure assessment, but also communication for air quality advice to a city, the citizens within an area in which the service is provided. So hopefully this...
To explain the idea of citizens' observatories, we can look at any modern European city. Air pollution is a real problem, and most cities can only afford a small number of fixed measuring points. These give accurate but limited data coverage. Now imagine we could have numerous smaller measuring stations with individuals gathering data in real time. These mobile monitors, which in the near future will become smaller and easier to carry, can give us a more complete picture of air quality. This is made possible by the miniaturization of sensors combined with the transmission capacities of modern smartphones. Citizens will not only be helping to collect data, they will also get something useful in return. Real-time pollution maps, for example, could indicate alternative travel routes, helping cyclists to avoid heavily polluted zones.
So the aim of CitySense is to empower people in environmental decision making, to give them new tools to assess their environment, bring them together in a citizens observatory where they can discuss with other people about air pollution issues and try to influence decision making.
Okay, so from the project, those sensors that you saw, it was essentially got to a similar conclusion as Dr. Jared had with the campus, that at the moment we're not quite there yet in terms of providing accurate information on air quality, but getting an indication of levels that are higher or lower. And I think the real point of the project was more to try to communicate that to people that don't have any background, in air quality. But some of the products that came from the project, so I mentioned these sensors before. We had one that could be worn like the camper could. On the right there was one that was static, which could be placed at home on a balcony. So focusing on the personal monitor first, the point at which it got to was we were able to get the data onto an interface online, and this was considering also using the smartphone or the accelerometer that are in smartphones these days, coupled to via Bluetooth the air quality sensor on a dashboard, information such as air quality, but also meteorological parameters such as relative humidity and temperature, to be able to get to a point of mapping out where people are and getting an indication of the air quality there. So it's kind of moving beyond air pollution assessment in that in terms of scientific research, but moving towards the realm of public information, so empowering people. Empowering was the key word they used in the project, to use this information to make changes by personal decisions, taking one way to work on a bike or another, but also by realizing there is a problem with air quality and hopefully putting pressure on local decision makers to make change for the better. Okay, and an interface that they had from that was taking information from different means. One was the personal sensor, one was the static sensor, and we'll go into what came from that next, but just to show that this was an interface that was produced and hopefully is where we're moving in terms of air pollution assessment for scientific research, but also for public health advocacy. So then focusing on the static sensor, which we also used, this is just showing the air quality and meteorological parameters over several days from the one unit, and they essentially this data was being uploaded. It was coming from the unit via GPS and put into a dashboard online, so you're able to go online and track this in real time. So while looking at this might not be too useful for you, the point was to take this data and put it into something called data fusion, in which you're taking environmental parameters to look at air quality or predict what air quality would be like, not only now but into the future based on other predictions as to weather and urban design. So going beyond that escape model, if you remember the escape model that predicted the air quality due to urban design features, to try to give a more accurate representation of the air quality, but also to do this in a way that was kind of live fed online for you to access and see what the air quality might be like. Now here you have for each hour of the day a layer produced from that model, but it probably makes more sense when you put that together. This is just a GIF, but you can imagine that sometimes for the human mind it's easy to see patterns in different ways, but you kind of really get a sense as you go throughout the day and you see those real pulses in the high concentrations, and the concentration being, you can't really see, but the darker color, which is red on my screen, that this is really reflecting essentially the peak commute times of traffic in the city. You can see they kind of follow the arterials as you go throughout the day. Okay, in terms of effects assessment, we have seen how we can maybe better measure the actual exposure levels, but then the consequences of those exposure levels. Just a couple of slides on this, but the PASTA study, which is another European Commission funded study, I mentioned before we might have, we do have online surveys which are more easily able to follow up a larger number of people to see what or how their daily activity in an environment is affecting their exposures and outcomes from that. So there was an online questionnaire that focused on active mobility behavior, and they were followed for over a year. I think every 2 weeks they were in contact again to ask about their behavior and outcomes from that. For different reasons, but one which I think is most interesting is to look at how their environment is affecting their mobility. And to help with that, there was a sub-study called the Health Add-on, which is kind of detailed in the bottom left here, in which it was 60 people, 20 people from, 40 people from 3 cities, Barcelona, Antwerp, and London, were followed for 1 week in 3 different seasons carrying ambulatory sensors, in this case a macrothermometer, which is measuring black carbon, which is another form of particulate matter in the smaller size range, but also physical activity. They were also tasked with performing certain health measurements such as lung function, and just seeing, taking the different transport modes. This was people that could be in public transport, private transport, or cycling, to see over that week how their behavior or activity is affecting, for one, their exposure, and 2, any effect in response. So just essentially with technology now we're better enabled to follow people for a longer period of time and with a larger pool to get essentially more information, to see a bigger picture as to how exposure might lead to effects. And then just an example of a new health measure that is being used in this PASTA project, but other projects as well, in which this is essentially an image at the back of the eye to look at inflammation occurring or a change in diameter of the blood vessel. And this could be, you could attempt to associate this with exposures from that week of which they were followed. So people had this image taken before and after that week to see if there was a difference. And I think they're still looking at the data for that now, but essentially you'd expect with the exposure that the blood vessel will increase in diameter because of inflammation. Okay, so in terms of cleaner environments, well, there's efforts being put into what you might call a health impact assessment, which essentially explores scenarios as to if you, say, reduce or shift X amount of people from private transport to public transport, what are the benefits or changes in terms of better air quality because you have less emissions, less traffic on the road, but also other consequences such as, do they get more physical activity because of this change of behavior? Is there changes in noise and other factors? So they look at how changes in policy, thinking back to that slide at the beginning with pathways, how policy affects outcomes such as death, mortality, or disease, also known as morbidity, that with changes in that policy, what you might expect to see in terms of, it could be money saved in terms of public healthcare costs, but it also could be communicated in terms of healthy life years lost as a result. So this is to show that in this case in Barcelona, from the same PhD student, Natalie Mueller, that it was estimated to give you an idea, of 12,000 deaths were prevented because of a shift to more active forms of transport due to physical activity gains. So essentially from exposure assessment, this data is being used to feed into these models to predict with a certain exposure what is the effect or outcome from that. And this is just to show that it's done in other cities as well. This was in Brisbane, my hometown. They did a similar thing. If people were shifting from motorized transport to active transport, how that related to or translated to savings in terms of public healthcare costs, but also healthy life years lost. So yeah, so just to finish, there's good and bad news. The bad news first is that air pollution is known to adversely affect us. We know that it is not good, and at certain levels it's worse. Even in well-regulated cities and countries such as the US and California or LA. And the noise can worsen while physical activity may improve these health outcomes effects. So thinking of that interplay when you're actively commuting, it's good that you're physically active, but it would be better if you're doing that in an environment that was of better air quality. Then the good news is that a shift to active or public mobility public transport can reduce air pollution and noise while increasing physical activity. So this is main messages coming out of a lot of exposure assessment work these days, such as that PASTA project. And that for urban living design, example greening cities, for cleaner cook stoves can improve environmental quality. So just some things to think about in terms of taking information from exposure assessments and how that can relate to the public domain. Okay, so I think we're getting short on time, but yeah, just to thank again UCLA, or the Fielding School of Public Health, for having me here. Also Colorado State University and the Institute for Global Health for allowing the work that was presented. The funding bodies of those including the Coca-Cola Foundation, European Commission, and National Institutes of Health. And yeah, if you have any questions, I think we have at least 5 minutes to try to discuss that. Hopefully you've learned something, understood something from that presentation, but are there any questions or anything that anyone would like to discuss or bring up?